Chula Radio Plus presents Chula Innovations Unlocked.
Omeprazole is a common medication used to treat certain heart and esophagus problems by reducing acid in the stomach. But perhaps good treatment option for indigestion may already be in your spice rack: turmeric. Turmerics are harvested for their rhizomes and some for consumption. The rhizomes are used fresh or boiled in water and dried, after which they are ground into a deep orange-yellow powder, commonly used as a coloring and flavoring agent in many Asian cuisines, especially for curries, as well as for dyeing characteristics imparted by the principal turmeric constituent, curcumin. In mid-2023, a study was published saying Thai researchers suggest that turmeric, which contains the compound curcumin, could be as efficient as omeprazole when it comes to curing dyspepsia or indigestion. Chula Innovations Unlocked talks to Associate Professor Dr. Krit Pongpirul from the Department of Preventive and Social Medicine, Chulalongkorn University, one of the researchers, about how local herbs and local wisdom is as beneficial as Western remedy. Dr. Krit, thank you so much for your time and welcome to the program. My first question is, what are the main causes of dyspepsia?
Oh, there are several causes. Maybe from the people's behavior.
Okay.
Maybe someone consumed too much of like sour or spicy food. Maybe alcohol drink. That's a very common.
Okay.
And maybe some stress. Yeah, that can create too much acid production.
How much is too much acid?
It's unclearly defined.
Okay.
But it depends on individuals and also the individual's threshold, before he or she can feel it.
Okay. Now, what is the worst thing that could happen if left untreated?
For the dyspepsia, for some people turns into real ulcers.
Wow.
And maybe some bleeding. That can be life-threatening as well.
Right. So you're saying if left untreated, death could be a consequence.
You can say so, Kap.
What is the common practice of doctors when they encounter patients with extreme stomach aches?
Usually we base on the symptom description by the patients and also some physical examinations.
Okay.
And without a specific investigation in the first place.
Okay.
And usually we try first with some conventional drugs, like omeprazole or antacids. And so usually we rely on the history and the symptoms and some physical examination without specific investigations. And we prescribe some group of medicines, for example, the antacids or proton pump inhibitor, and maybe some other substances. These drugs are usually available over the counter at local pharmacy stores. And then we reassess if the conditions improve or not. Usually it should be resolved in 4 to 8 weeks.
Weeks we're talking?
4 to 8 weeks, that's 1 or 2 months.
I see. Now, how did turmeric step in when it comes to curing symptoms of dyspepsia?
So turmeric is a local wisdom, and it can help reduce inflammations and reduce some acids and release some gas. So it's come to play a role in the Thai context when we don't want to reduce the acid too much. And usually in conventional medicine practice, we use a proton pump inhibitor, and some people consume that maybe too long duration, and reducing too much acid doesn't mean it's good.
Right. So once your stomach becomes alkaline, is it?
Yeah. So that's acidic versus alkaline.
Right. Yeah. So if it's too acidic, it's not good. But if it becomes alkaline, that's not good as well.
Correct. And now we have known more about the bacteria, the good and the bad bacteria in your body, and sometimes the acid is useful because some bad bacteria cannot get through the acid conditions.
Okay, so local wisdom, we know that turmeric helps with inflammation. What did your research find?
So we try to compare whether the turmeric and conventional drugs like omeprazole.
Okay.
This is the one kind of drug under the proton pump inhibitor group,
Okay.
which has been commonly used in conventional medicine.
Okay.
So we try to compare whether it's comparable in terms of efficacy or not.
And the results?
It's quite promising. It's quite comparable. So we conduct a clinical human trial.
Okay.
So we have the participants consume blindly, okay, the turmeric capsule compared with the omeprazole capsule.
Okay.
And then we measure the symptoms improvement.
Okay.
So the score that we use is called severity of dyspepsia assessment,
Okay.
shortened to SODA.
Soda.
Yeah, SODA measurement. So we calculate the SODA score before versus after across the groups,
I see.
and we found it's comparable to omeprazole. And before that, we have to make sure that the participant did not have the severe form or the pathological dyspepsia.
Okay.
You know, that we focus on the functional dyspepsia, not pathological dyspepsia.
Right. So what are the differences between the two types?
So for pathological dyspepsia, maybe the person have ulcers, maybe some already bleeding in the stomach.
Okay.
So we need to do the gastroscope.
Okay.
To visualize, to make sure that the participant have only the functional dyspepsia,
Okay.
not the pathological ones.
Right. And functional is like just for that period of time?
Yes. So we don't see the real ulcer, but maybe some abnormalities in the environment
Okay.
of the acids of the
Right.
bacteria in the stomach.
Right. And the turmeric that's applied is put into this capsule.
Yes. So this is like one example of the product that is kind of called a crude extracts.
Crude
So
extract.
this is not like a Western kind of chemical extract. So this is like a crude one.
Right. So how did the patients react knowing that, you know, this disease, this pain could be cured by using local wisdom?
So I would not say it's a cure because this dyspepsia is like functional, so it can just come and go throughout the lifetime. And as I mentioned earlier, stress can be one reason for having the dyspepsia.
Okay.
So this is like a symptom relief kind of approach.
I see.
So it's not like a cancer cure or something like that.
Right. Now, since turmeric is pretty much herbal, is there such a thing as overdose when it comes to herbal medicine?
Yeah, everything that if you consume too much, that would not be good at anyway.
Right. Okay. Can this turmeric pill be used with conventional medicine side by side, or you should have to like choose only one way or the other?
It depends on the purpose and also the patient's condition, especially if the patient already taken some conventional medicine for their chronic diseases. So we should have to make sure that the patient and the responsible doctors discuss and agree upon the use of this.
Right. Dr. Krit suggested that consumers should be aware of side effects of curcumin extracts, such as allergy and bleeding risk, especially for those who take anticoagulant or anti-pellet medications. Experts suggest that upon taking curcumin extracts, patients already consuming pills must always consult with physicians to make sure turmeric doesn't interact poorly with any of the other medications they are on. However, Dr. Krit added that curcumin and turmeric is generally considered safe when consumed in the amounts typically found in food. Typically, turmeric spices contain around 3% curcumin. So, if we do not yet have access to the, I would say, condensed turmeric that you have in your hand, can we just go with fresh turmeric or what we find in the supermarket?
Yeah, so that's a food approach. Yeah, that's always fine. Yes.
Right, but we have to consume pretty much in order to get that amount.
For the treatment effect.
Okay, so how much would you reckon, or it depends on the individual? Or?
I rather not comment on that.
Okay. And what do gastroenterologists have to say about this approach?
So actually this clinical trial has been done by Professor Dr. Preventive. He's one of the best gastroenterologists in Thailand.
Okay.
And this study actually collaborative work across many medical schools. So the gastroenterologist is a kind of a specialist.
Okay.
So usually this condition has been managed by general practitioner, but for some cases we have to consult with the gastroenterologist, especially when the patient did not respond in an anticipated time frame.
Okay. Any side effects so far?
Burping?
Burping.
Yes. So,
And
but this is
farting, I
minor.
assume.
Yeah, for farting and burping. So we release the gas like upward and downward.
Okay. What is your next step of research and development in this?
So for this one, because the turmeric is already in the national list of herbal medicine, so this is like a retrospective way of conducting evidence to support the already exist in the list of Thai herbal medicine. And I think the next step is to find the most efficient use of resource at the national level. But because you know that people can grow turmeric everywhere, but the quality of the turmeric actually depends on how you grow it, the soil that you use, so the amount of curcuminoid that contained in the turmeric itself. And at the end, we want to think about how to utilize this evidence from the research to support commercialization.
So are you saying that there are a variety of turmerics out there?
Yes.
Right, and this one in particular is like just one particular type?
So this research did not specify the specific root of the turmeric sources. So this can be like a generic benefits of any kind of turmeric. But I think we can make it the next step, like to maybe differentiate across the varieties of turmeric that we have.
Right. So once we could produce this in a mass scale, when it compares to the value for money, comparing what you have in your hand with the Western approach, this one will be a bit cheaper, I assume.
It may not be that case because you know that producing herbal medicine is actually relatively higher cost.
Is it?
Yeah.
Oh, okay.
You need to find a good source of herbs, right? And then you because the economy of scale is not that big for the moment, so it cannot compete with the Western drug at this point. But if we think of it from the other side, we can make it like a household approach. So actually I believe that we don't need to produce a capsule. We just try to educate or try to provide more information how individual can make this at the household level.
Or maybe consume this on a daily meal, Maybe. So this is like layperson kind of use. We don't have even to like spend money, right? And that's it. That's pretty much it. Wow. If we believe that prevention is better than cure, Dr. Krit, what would be the best approach towards living a life which prevents dyspepsia from occurring in the first place?
So I think the main key point is the term moderate.
Moderate.
Yeah. So we should have the moderate consumption, and like one of the common cause for the dyspepsia is the stress and the alcohol. So it's fine to have stress. Stress make productivities.
It stimulates you.
Yes, yes. But if you don't have stress, you may feel lazy or something like that. But too much stress is not good. So and it will also produce acids. And alcohol actually like moderate consumption should be okay. But it's not clear whether what it means by moderate, because each person have a different systems. So two people may have different excretion of the alcohol or alcohol metabolism. So it depends, right? But the some people who already have this dyspepsia, they try to think about how to solve it, what medicine to take it. But by thinking or worrying of the condition actually may make things worse, right? Because when you think about some condition too much,
right?
Some people think about cancer, and that's fine.
Okay.
But we need to get evidence to support whether the cancer is related to the conditions or not.
Right.
But usually it's not that common.
So not only do you have to adjust your behavior and what you eat and how much you eat, you also have to kind of preset your mindset so that it doesn't make things any worse.
Yes.
Whoa, okay. Well, congratulations on your success, doctor. And I wish you the best of luck and looking forward to your success. And not only will this help boost the health of Thai people, but also perhaps the local economy for agriculturalists as well. All right, so good luck and thank you, Ajahn. Thank you.
Chula Innovations Unlocked is produced and presented by Superjohn Klinsawan. This program is brought to you by Chulalongkorn University.